Well, good afternoon. This is Dr. Doug Evans, and I'm chair of the Department of Surgery at the Medical College of Wisconsin. And we're continuing our series of getting to know our patients, hopefully for all of you watching, inspirational videos of strength, resilience, recovery, and success with treatment. So today I'm with Barbara and David Bendlin. Maybe we could start with just your story with pancreas cancer, how you were diagnosed and how what the treatment has been like. I know that I shared with you that I have an extended family member now going through treatment for pancreatic cancer, and I think these stories of hope and strength and encouragement are just so important.
Okay. Well, first of all, before I was diagnosed, I had been retired. I had worked at a local university. I was a very healthy person. I was working out an hour a day. I'm an avid hiker. I had just thought that I was going to live to be 96 and I was going to die on the top of a mountain someday. And then in July of 2018, I started to get some strange symptoms that weren't normal for me. I had amber-colored urine, gray loose stools, and itching all over my body. And something was definitely wrong. So I went into the doctor and they did some blood work and they told me to come back a couple days later for an ultrasound. And that morning they did an ultrasound, and by noon they had called me back to say, oh, we see something, we're going to do a CT scan. So they did a CT scan, and then that afternoon my internal medicine doctor called me in and said, there's a mass on your pancreas, it looks like it's probably cancer. And I was just shocked. I had been so healthy all my life. I never smoked, I never drank, I never did drugs. We ate well, and I was just shocked. And my husband was with me. He was in shock immediately too. Our world just came crashing down because I didn't know that anyone had ever survived pancreatic cancer. I only knew people who had died from it.
And you bring up such a good point that one of the challenges with pancreatic cancer, and especially one of the challenges with early diagnosis, is the fact that there are really no predisposing factors that we know of that cause the disease. So unlike some other diseases where lifestyle modification may be an effective preventive strategy, with pancreas cancer, the major risk factor is being a nice person. We oftentimes say only nice people get pancreas cancer, but only a tiny percentage is related to tobacco abuse, the so-called Patrick Swayze phenotype of pancreatic cancer. A tiny percent is related to diet and obesity. Luciano Pavarotti, the famous opera singer, the most common one. But other than that, a tiny percent is related to genetic predisposition. And we're now doing gene testing on all of our new patients. But I just wanted to toss that in there for the people who are watching. Right now, at least to the best of our knowledge, it's not preventable. There certainly in the future probably will be techniques for early diagnosis, but probably no way to prevent this.
So yes, when I got my CT diagnosis, then they had to do an official endoscopy, but I had to wait about 12 days to get in for the endoscopy where they made it official. I was also jaundiced, and because my bile duct was being compressed, and that's where my symptoms had come from. So we got on the phone and we started to talk to my daughters. I have one daughter who lived in Hawaii. She's a marine biologist. She was out in the middle of the Pacific Ocean on a research vessel that day. We were able to contact her by phone. The vessel was out there for a month. And we told her what was going on, and she said, I'm coming home. And she said, well, you can't come home. You're on this vessel, and it's not going to be done for another month. So she actually told the crew, they turned the boat around, they took her to a port where she could fly home.
Wow.
And she came home and lived with us for about the next 14 months most of the time. She was able to work from home. Our other daughter that lived in Portland, Oregon, came about a week later. She spent about 9 months with us, kind of on and off, going back and forth to Portland. So they were just incredibly valuable as we started to enter this very confusing process of finding out about what chemo was going to be like, what my symptoms were going to be like, and so on. I had my endoscopy on August 1st of 2018 that confirmed I had pancreatic cancer, but it looked like it hadn't spread, so that was good news. Within the next week, I had surgery for a bile duct stent, and then the next day I had my port put in, and then the next day I had chemo.
And for the bile duct, you mean you had what we call an ERCP, or another endoscopy?
Yes.
Another endoscopy.
Yeah, it turns out that the first endoscopy, they had put a bile stent in, and it got plugged immediately, so the next week they had to do another one of those surgeries.
And when did we first meet in all
we
that?
didn't meet, so I was diagnosed officially August 1st. We didn't meet until December.
And what went on between August and December, and how did you end up coming to the great city of Milwaukee?
Yep, well, I had my chemo treatments in Janesville, Wisconsin, and I was really pretty sick with my chemo. In fact, for my second chemo treatment, I ended up in the hospital for 8 days with severe diarrhea. I was actually in intensive care part of that time and very sick. It turned out that chemo wasn't a great thing for me. I couldn't eat well. I was just exhausted. It was a really tough road.
And just for the people who are listening to this, there also are a couple of genes that are associated with sensitivity to the chemotherapy that's given for pancreas cancer. And around the time that you were being treated, this was just becoming better known.
Okay.
So this might not have been known to your doctors at that time. But one of the things that we do here at the MCW Cancer Center is we test everyone with pancreas cancer for any kind of abnormality in those two genes. The other thing that is done frequently by our medical oncologists is to adjust the dose and to also use fluids. I mean, the chemotherapy for pancreas cancer, well, you're absolutely right, it can be fairly, oftentimes people use the word aggressive, or it can be a little bit difficult, but there certainly are things we can do to modify that. And that requires a team of doctors who are familiar with giving that chemotherapy. But
yeah, I was very fortunate. I had not met Dr. Evans nor his crew yet, but my oncologist right away knew that he needed to back off on what I was having, and so he changed my my medication and chemotherapy. And after that, I was better. But it was still a tough road because it really would wipe me out, and I really had no appetite at all. I was told that if I was going to have surgery, and it looked like surgery was possible, that I needed to really stay in shape and kind of prepare like I was preparing for a marathon. Well, I'd always been an active person, but I was so wiped out. But my daughters really helped with that. They would say, "Mama, come on, it's time to get up. We're going to go for a walk." And in the winter, I actually snowshoed with them every time there was snow. So they helped keep me busy and active. I went to Zumba with one of my daughters. Even though I didn't feel like it, I went.
good for you.
And then when I first was introduced to the surgeon that my insurance company had assigned me to, he wasn't sure that he could do the surgery and get all the cancer. And that made me pretty fearful. So we looked into actually switching insurance companies, which we did in midstream through my treatment. We switched insurance companies so that I could come and meet Dr. Evans.
Wow.
And we met Dr. Evans then in December. The chemo had worked to shrink my tumor quite a bit, but I still had no real hope. And then when I met Dr. Evans, he looked at my scans and said, "We can do this." And he touched my shoulder and he said, "You're going to be fine." And it was the first time that I really had hope that I was going to make it through.
Yeah. Oh, wow.
We should mention you also underwent radiation treatment
Yeah,
as well.
that was not till January.
Yeah. So the radiation occurred. Did that occur here or back
That
home?
still occurred back in Janesville. I had
Yeah.
5 weeks of radiation every day for 5 weeks.
Yeah. And for those of you watching this who know someone who's receiving treatment for pancreas cancer, or you're investigating pancreatic cancer treatment as part of what you are doing right now, the radiation therapy does remain a little bit controversial. Those of us here feel strongly that radiation should be part of the treatment program, but that probably is not an opinion that is shared everywhere. I think it's probably the majority opinion right now, but there certainly is some debate in medical circles. So if any of you are watching this and your doctors advise just chemotherapy and then surgery, it certainly is not the wrong answer. It's just, in our opinion, maybe not the optimal answer. But you went through the radiation, and what was the surgery like?
The surgery wasn't as difficult as I expected. Like I said, I had stayed in shape even the week before. I was walking 3 or 4 miles a day. And I had surgery on a Monday. Of course, didn't know anything was happening until I woke up. Here at Freighter, I could not believe the care and attention and just the love I felt from all of the staff, and they were just so friendly and helpful. I was only in the hospital I had my surgery on Monday and I left the hospital on the next Sunday, so I guess I was in here for 7 days.
Yeah.
And it went well, it went very well.
You know, when the medical community has actually looked into this and looked into how patients do after major pancreatic surgery, what's most important is actually not the surgeon, but the hospital, the volume of operations that they take care of, and the quality of the nurses and everyone else that participates in the care of the patient. I mean, that's just so important. Here we're lucky enough to have a dedicated surgical oncology floor where the nurses are very experienced, and it just is so fortunate. And then we've followed you ever since, right?
Right. I had my surgery in March of 2019, and I have had scans every 4 months, and now we're at every 6 months, and so far things have been clear.
And how was the gastrointestinal function and weight after the operation?
I would say at least 6 months to kind of get the body back to normal. I had trouble gaining weight at first and gradually did gain weight. I had a lot of trouble with bowel issues, loose bowels. I still do have some trouble with that, but it probably took about 6 months for things to feel normal again.
Yeah. David, from your perspective, I mean, obviously it sounds like you have the two of the world's greatest daughters who took a big weight off of your shoulders. But how was this whole process from your perspective?
Well, of course, the diagnosis was terrifying, and both of us were in shock. And having our daughters be there to do things like take notes during medical consultations was
So
very,
important.
very helpful.
Yeah.
Because we sometimes were just so stunned that we couldn't even keep track of what was being told to us by the various medical staffs. So that was very helpful, and I would recommend for anyone who is receiving treatment that if you can have someone like that who is sort of someone to represent be on your half, take notes. That's a really important.
So important. I can't tell you how thrilled I am when there is someone else in the room who has a notepad and a pen, just ecstatic. Just right when I walk into the room. You're absolutely right. Yeah.
Yep. It just really helped also at home, running day-to-day things in the house. Having that extra encouragement, we were very lucky to have our daughters for that purpose. It's been a long journey. We're very, very happy that we were able to make our switch in our insurance and come to Freighter, and we've been really happy with the care we've received
Yeah.
here.
I mean, the insurance challenges are something we deal with all the time, and this will be, I think, the big challenge for patients going forward over the next 4 or 5 years. I think this will be the biggest challenge. I think you'll see the controversy of narrow network insurance plans on 60 Minutes, on a number of network programs. I think the government will eventually intervene here, but it may not occur for another 4 or 5 years. We'll give you, Barbara, the last word. Perhaps a few thoughts of inspiration for those people who are struggling a bit. I think you had your moments of struggle yourself,
definitely.
and you were able to kind of
Yeah.
bounce back for that. What do you think was responsible for your ability to kind of get through those tough times?
Well, first of all, this was not an easy journey, but yet I did certain things to really ease the journey. I set up a Caring Bridge website, And that's a website where you can post what you want to so that friends can see what's happening with you, and then they can make comments and respond. And I found that so helpful because I would read their comments and it would just fill me with love as I could feel that. I did some other things like at home with our daughters. Every night before we'd go to bed, we did what we called thankfulnesses, where we would go around in a circle several times and do thankfulnesses of what we were thankful for. In the middle of the night when I'd wake up terrified, I had some beads that I would finger and be thankful. I'd have all my friends on my beads and my family and my cats, and I would focus on that instead of the fear that I was feeling. I also got involved in our church handbell choir. I wanted something to do that would distract me, and so I asked if I could play in the handbell choir, and sure enough, they welcomed me in. And then practice, and while we played, I wasn't thinking about having cancer. And I know that we're wrapping up here, but I just want to say too that I took a 3-week trip to Germany this fall on my own. It was a solo trip. I was hiking. I did 8 to 10 miles a day on a hiking trip, and it was my cancer victory tour.
There you go. I remember you telling. We have pictures of that too. The cancer victory tour. So great.
The cancer victory tour, right?
Oh wow, such great stories, and also such great advice for anyone who's watching this. Well, Mrs. and Mr. Bendlin, or Barbara and David, thank you so much for sharing your story with us, and I look forward to seeing you again for a number of years to come.
Okay, thank you.